Good evening, everyone. Sorry that this is so late, but this is the only opportunity that I've had in this day to be able to sit down and actually get the lecture uninterrupted done for you. So, like I said, I apologize for the delay, but it will be posted on Friday nonetheless. A little later in the evening than I anticipated, but it is posted. A few things before I really get started. If you hear some noise in the background, that's my dog Star. She's chewing on one of those rawhide bones that I just got for her. So she's in here with me. And for the most part, the house is pretty quiet, so I don't anticipate any interruptions. But in the event that we do have one, I will just address whoever may, barge in the room. And then I'll get right back to what it is that we need to do. All right, so hopefully you have everything it is that you need for a study aid as I go through this lecture. Make sure that you have the worksheet that I gave you on Wednesday so that you can follow along with me. Now, I actually have it up on my computer as I am doing this lecture, so if you see me look over to the side, that's what I'm looking at. Also, make sure you have your textbook, have your notebook for any notes that you might need to write down, and I think that will pretty much do it. Of course, a writing utensil. One of the other things that you need to be mindful of is that this chapter 7, is one that you will need to make sure that you access the website in order to practice identifying the various parts of the skull. Now, on the worksheet at the bottom on the second page or on the last page, you have 4 diagrams. Those 4 diagrams are actually the 4 diagrams from the website that Marcy, the student that I told you make the study sheets, did she actually access. Those are the same ones that I'm using this particular semester. Of the 4, I will choose one and have that on your quiz. But don't just try to look at them on the worksheet and learn what they are. Actually go to the website for the textbook and practice over the course of the weekend or practice over the course of the next several days, so that when you see one of the 4, you'll have no problem identifying the different parts of the skull. You will also be given a word bank, so the word bank that you'll find on the website or the word bank that you may actually see on the worksheet that Marcy provided, you will have the same word bank. Now, the thing about it is that there are some parts of the skull that we are not going to cover. And so when you get your quiz, you will not be responsible for answering those. You will only be required to identify the ones that I have circled. So you'll notice when you go to the website, they have little black dots beside them, and you're to take the word and place it on the black dot that you think is appropriate. Well, only the black dots that I have encircled will be the ones that you're responsible for identifying. Your first quiz is just going to cover the information, the general information in regard to the skeletal system that I'll go over first, and then we will go over the bones of the cranium. Facial bones will not be included on this part of the quiz. That quiz will be next week when we finish up the rest of the axial and the appendicular skeleton. We'll do the facial bones, the rest of the axial skeleton, and the appendicular skeleton. So for this week, for Wednesday, your quiz will just consist of the general information on the skeletal system and the cranial bones. So having said that, let's go ahead and get started. Now, because I am at home and I don't have the luxury of having a big old whiteboard in my home, I went and got my own. Yes, it's smaller, but it will serve the purpose in the event that I need to make any type of diagrammatic representation. Now, the one thing that I haven't figured out how I can correct on this is that when I write the information, it's going to be the mirror image to you, so it's going to look backwards. Still trying to figure out how I can work that out without having to learn how to actually write backwards, but be that as it may, hopefully I won't have to do a whole lot of writing, and I'll more or less be using my whiteboard just for diagram. Okay, so having said that, let's start with the skeletal system. Some of the general information you probably already know about our skeletal system. We have approximately 206 bones. when we're actually talking about the bones and the study of the bones. Is called osteology, which should be pretty familiar because when we were talking about tissues last go around, we were talking about the osteon, and the osteocytes are bone cells. So that prefix osteo is always going to reference bone, or the skeletal system as we're talking about right now. Now, our skeletal system has various functions. It provides support, protection, and allows us to move. Our skeletal muscle is attached to our skeleton to enable movement. In addition to that, a process called hematopoiesis. Now remember, now I'm going to draw. And y'all know what bone this is. Made it real big. That's the femur. Remember, we talked about the femur when we were dealing with tissues because we had the ends of the bone, and then we had the shaft of the bone. Now, when we were discussing it in the tissue chapter, we were discussing it from the shaft, which is the diaphysis, remember? And inside of the diaphysis was where we would find the osteons, because the osteons and the osteocytes that reside within the osteons are actually found within compact bone, and that's what we would find within the shaft of the bone. Well, we identified the ends of the long bones as being the epiphysis, and within the epiphysis we had that red bone marrow. We refer to it as spongy bone, but it's also known as cancellous bone. But it's in this particular part of the bone, the ends of the long bones, the epiphysis of the long bones, where hematopoiesis occurs. Hematopoiesis is actually just the production of red bone cells and red bone marrow. So we're talking about erythrocytes, the red blood cells. All of that goes on at the ends of long bones. And if you're wondering to yourself, well, she keeps saying long bones. Aren't all bones the same? No. Long bones are those that have ends and a shaft. And as you can kind of figure out, all of our bones in our body don't have ends and a shaft. But examples of those bones that do are the humerus. The humerus is the long bone of our upper arm. The radius and the ulna are the long bones of the forearm. The largest and longest bone in the body is the femur, which is their thigh bone. And then the bones of the lower leg, the tibia and the fibula. All of those are long bones. And when we get to the appendicular skeleton, we'll look a little bit more at those. All right, so far we have protection, movement, support, hematopoiesis. In addition to those functions, our skeletal system also is responsible for inorganic salt storage. Inorganic salts include sodium, calcium, potassium, magnesium. All of those inorganic salts are stored within our skeletal system. And then finally, that was somebody coming in. The final purpose of our skeleton is for energy storage. Now, we don't often think about the fact that our skeletal system helps us or helps to supply us with energy. But let me put my femur back on this whiteboard so we can talk about something real quick. Okay, here's my long bone again. Now remember, we said here's the end and here's the shaft. Well, where the end and the shaft meet, there's no clear delineation, but it's called the epiphyseal plate. And sometimes they're referred to as like the growing plates. Well, at the epiphyseal plate, we've got this spongy or cancellous bone kind of meeting with this compact bone. And remember, compact bone is really, really hard. Well, at the epiphyseal plate, you kind of come to like a happy medium, or the in-between, between the spongy bone and the real hard bone. And it's called yellow marrow. Well, we've heard of red bone marrow. We know that's at the ends of the bone. But that yellow marrow is at the epiphyseal plate, where the epiphysis and the diaphysis kind of come together. Well, what do you think about, or what is typically yellow? And of course, you know, I relate everything to food. and chicken. So if I'm thinking about chicken and I'm thinking about something yellow on the chicken, what is it? Fat. That's exactly what it is. Now let's think about what fat is. Something I have a little bit too much of, and I'm trying to get rid of that. But anyway, fat is actually an energy source. That's why we burn it. We use it. And we're trying to, it helps to keep us going. You think about it. Let's think about polar bears for a minute. Polar bears live in the tundra where it's really, really cold. The Arctic, yeah, because the penguins live in the Antarctic, right? Yeah. So the polar bears live up north. Well, you think about it, during the spring, even though they're in the Arctic, it's still really cold. During the spring, they forage and they eat and they get all that they can get during that time, because during the winter months they hibernate and they pretty much just sleep all that time. Well, if you slept all that time as the polar bear did, and you didn't have enough energy stored up during that sleeping period, what would happen to you? Or what would happen to the polar bear? Essentially, it would not be able to continue to live because it's not eating, it's not going hunting for anything. So it uses those fat reserves as its energy source. Our bodies do the same thing. That's how people can survive for days and days at a time and not have any food. Because what our body will do is then say, okay, the first thing normally that we would burn if we were eating would be carbohydrates. And a lot of the foods that we eat have carbohydrates. They're good carbohydrates, they're bad carbohydrates. Okay, this is not the nutrition lesson, but I'll just give you a little blurb. Carbohydrates are essentially the energy source that our body wants to use first. So the more carbohydrates you have, then the more you have to burn before you actually get to the next source that's utilized, which is fat. So when you hear about these low carbohydrate diets, essentially what they're trying to get you to understand is that the fewer carbohydrates that your body has to get through first, the more quickly it can get to the fat and burn it. So the same concept applies if you're someplace and you don't have any food. Your body will take from the energy reserve. It will burn carbohydrates first, and when there's nothing else left, then it will begin to go to those fat deposits, the energy that we need. So that's why our skeleton is also responsible for a certain amount of energy storage. Now you can tell somebody that. All right, let's continue on. Okay, our skeleton is divided into two divisions. I introduced this to you early on. I want to say it might have been in the first chapter. Yeah, I think it was in the first chapter that we talked about the axial and the appendicular divisions. Well, now we're actually going to identify the axial and the appendicular skeleton. Just as before, the axial skeleton consists of the head, the neck, and the torso, while the appendicular skeleton consists of the upper and lower extremities. Now, in the PowerPoint presentation and in the handout that you have, it goes over the number of bones that you need that are in the axial and the appendicular skeleton. I'm not so much concerned that you know about the number of bones, because we are going to go through and identify all of the bones. So the number right now, you don't need to focus on that. Just focus on the axial skeleton being the head, neck, and torso, also referred to as the body proper, and the appendicular skeleton being the upper and lower extremities. Excuse me. Oh, okay. I'm checking on the dog. Okay. Now, even though I said that you don't need to know the number of bones per se in that slide that it goes over with the axial and appendicular skeleton, there are some bones that we do need to know the number of, and those are the cranial bones. So when we get to the cranial bones, it's going to be important to understand that there are a total of 8 cranial bones. And we'll go through and we'll identify them, and we'll identify what keeps them together. But before we get there, let's move on to the next bulleted point on the worksheet, which is about bone classification. Our bones are classified into different categories. There are long bones, which I just recently identified to you. There are short bones. Short bones are kind of cube-like. They are the bones that you'll find within the wrist. You can find some in the ankle. Also, the bone of the heel is a short bone. It's not rounded per se, but it's just about this big, and it's called calcaneus. That's the bone that actually has that long tendon attached to it that attaches to your calf muscle called the Achilles tendon. We'll talk about that when we get to muscles. All right, we also have flat bones. Flat bones are typically what they sound like. They're flat. Many of our cranial bones are considered flat bones. Our frontal bone is a flat bone. The parietal bones that are on the sides of the head are flat bones. The occipital bone. And that's because their width is very, very narrow. Also, our clavicle, the one that my quarterback, just recently broke in that game. He knows we need him. We need him, even though he does what he does most weeks. He's been getting us through, but now he has broken his collarbone. And it's also called the clavicle. That's the scientific name for it. But the clavicle is also considered a flat bone. So are our ribs, because they're long, they're thin, and they're about that big. Okay, irregular bones. Well, they are just like they sound. They are irregularly shaped. And the best example to provide would be our vertebrae. Our vertebrae actually surround the spinal cord for protection. But we have another one that we can go ahead and identify right now, since we're going to talk about the cranial bones, the temporal bones. Now, most of our cranial bones, like I indicated, are flat. The two at the sides, the one at the front, the one at the back. But the ones right here, when you get a headache and you do like this and you rub it on your temples, this is your temporal bone. Your temporal bone happens to be an irregularly shaped bone that is a cranial bone. There are two other irregularly shaped bones of the cranium, but they are internal, and we'll talk about those in a minute. And then finally, we have the sesamoid, or the round bones. Typically, these bones are suspended within tendons, and the most common one that we know is the patella, commonly known as our kneecap. Okay, moving on. We've done classification, and now let's talk about arthrology a little bit. Arthrology is dealing with the joints. If you have arthritis, you have inflammation of the joint or joints. Now, joints are permanent. No, that's a suture. Joints are the union or an articulation between one or more bones. So if this is a bone like this, and this is a bone right here, and they meet right here, that is a joint, because it's an articulation or the meeting point between one or more bones. Now, there are different types of joints, and in the PowerPoint presentation, it goes over the freely movable joints, like the ball and socket joints of our shoulder and our hip. It goes over the semi-movable joints, or the unidirectional, like the hinge joints of our elbows and our knees. And then it also talks about permanent and movable joints that are referred to as sutures. We can find sutures anywhere that bones meet, but they do not move at all, like our cranial bones. Now, our cranial bones have sutures in between them, but they didn't always start out as those fused sutures. Sutures literally fit together like pieces of a puzzle, and they hold together very, very tightly. But our cranial bones didn't start like that, because if you think about it, in infancy, our head is really, really small. And if our cranial sutures fused initially, then when we continue to grow, we'd end up looking like big people with shrunken heads. So for that reason, we have what are referred to in infancy, they're called fontanelles. We commonly call them soft spots. But they're on a baby's head, and what they are is dense connective tissue that's holding those bones in place, but allowing for the growth and the development of the brain. And over time, those bones will eventually come together and begin to fuse as the brain continues to grow. And then eventually, somewhere around the age of anywhere between 19 and 25, those cranial sutures fuse permanently. Wow. Between 19 and 25. Some of y'all didn't even realize that your cranial sutures hadn't even finished coming together yet, did you? Anyway, I digress. Let's continue on. So let's talk about these cranial sutures. Diagrammatic representation coming. Okay, so I'm drawing a cranium. And it's as if we are looking down on someone standing in front of us, facing the same direction that we are. Imagine looking down at a child that's facing the same direction that you are. So I'm going to draw some arrows to give you an idea. This is the anterior, and this is posterior. Okay, so the writing is going to be backwards. And I am actually going to draw the representation of the cranial sutures. Kind of looks like an Easter egg. And I'm just going to give you a second or two because I actually want you to draw that, because you'll need to be able to know where the cranial sutures lie. So this is us looking down on the child's head. This is the face or the front of the child's head. And this is the back. And then we've got these sutures on the head. So I'll give you a second to get that down. You know, now that I think about it, I guess I don't need to give you as much time as I think, because you can kind of put this on pause. Okay, so I'll keep going. All right. So these permanent immovable joints, the sutures, actually have names. There is a suture, and I'm just going to go ahead and put the names of some of these cranial bones up here. One of the easiest ones to know is the one that's right here, because it's our forehead. It's at the front. The name of that cranial bone is the frontal bone. That makes good sense. The two largest bones that really span the top and the side of the head, the frontal bone comes to about right here. This and all the way down, they're called the parietal bones, P-A-R-I-E-T-A-L. The parietal bones span the top and the sides of the head. And then just inferior to those, these here, are those temporal bones, T-E-M-P-O-R-A-L, on the sides of the head. I know that's kind of jumbled up, but it's temporal, T-E-M-P-O-R-A-L. And then finally, at the back of the cranium, we have the occipital bone. And all of this is in the handout for you to know as well. I just went ahead so that you could at least see them as I begin to talk about them when we go further into the handout that you have. So these are the bones, but we're going to identify the sutures because they are listed in order. And you'll notice on your handout, it has directional terminology to indicate where the sutures are. So the coronal suture, and if you remember that word coronal divided the body into an anterior, or the coronal plane divided the body into an anterior and a posterior portion or region. So the coronal suture is the one right there. It's at the posterior region of the frontal bone and the most anterior region of the parietal bones. The suture that is directly in the middle, dividing the parietal bones, is the sagittal suture. And if you remember, the sagittal plane divided the body into a right and a left portion, which is the same thing that that suture is doing. I know it's backwards, but just look on your worksheet. And then with the last two sutures, now these two, I don't have a really fancy way to help you remember those, but when you get to restorative art, the squamous suture, I can help you remember that because it has something to do with the temporal bone. But for right now, you're just going to have to remember those. So these two sutures separating the temporal bones from the parietal bones are the squamous or the squamosal sutures. Either one. I'm only writing it on one side, but it's on both sides. And then finally, the most posterior suture of the cranial bones is the lambdoid. Okay. All right. So now that we've identified the sutures, let's talk about something else that kind of holds them together. We talked about fontanelles being dense connective tissue in between the cranial bones. And I don't believe that I saw that information on the sheet that you have. So let me reiterate that, and I will put the word up there so you can spell it. Fontanelle is Fontanel. Fontanel. Fontanel, yes. And like I said, it's dense connective tissue between cranial bones prior to fusion, before they come together and fuse. Okay, so fontanelles, we know. But there are other points of attachment as well. Tendons will attach muscle to bone. As an example that I cited earlier, the Achilles tendon is attached to calcaneus, which is the bone, and gastrocnemius, which is the calf muscle. So tendons attach muscle to bone, while ligaments attach bone to bone. Something that we hear a lot about as far as in the NFL football players, or don't even have to be an NFL player. You could be a high school football player. You could just be a weekend football player, but you get hit the wrong way in your knee, you could tear your anterior cruciate ligament. It's attaching the femur to the bones of the lower leg. And if there's an anterior or something, there's a posterior of that same whatever it is, in this case, that ligament. So, ligaments attach bone to bone. And I'm going to go ahead and introduce that next term, which is an aponeurosis, but we'll pretty much look more of that when we get to chapter 9, the muscles. But an aponeurosis is just dense connective tissue that attaches muscle to muscle. All right. If you continue to look on your worksheet, you will notice that there's some helpful terms that have been listed. These anatomical terms will help you when you're asked or you have to identify certain parts or features of bones. And we have a foramen, which is a hole. Anytime you see a hole, it's going to have some type of adjective, but it's going to say foramen in it somewhere. A sinus is a cavity. And a sinus is a cavity or a space that's designed to reduce the weight of something. We have sinuses within many of the cranial bones. 3 cranial bones have sinuses and 1 facial bone has sinuses. And if you've ever had sinus congestion or sinus pressure, you know it hurts all through here, behind your eyes, and sometimes right up in here. That's because the bones that have those sinuses are the frontal bone, the ethmoid bone, which is behind the nasal cavity, the sphenoid bone, which is a butterfly-shaped bone that spans the anterior floor of the cranium. And those are the 3 cranial bones. And then the 1 facial bone is the maxilla. The maxilla is right here. This is what really gets you. This is the bone of the upper jaw. But sinuses are designed to reduce the weight of the skull. Okay, so a process is a projection. It doesn't have to be a very pointed projection. It just has to be a projection nonetheless. Meatus is a passageway. A fossa is a shallow depression. And a condyle is a rounded projection at the end of a bone. So, whenever I draw my femur, This is the head of the femur right here, but this is a condyle. Okay, it's a rounded projection. Okay, so now we move right into the cranial bones. As I indicated before, there are 8 cranial bones. And in the PowerPoint presentation, as well as on the worksheet, you will notice that there are certain anatomical structures that are located on the frontal bone. The frontal bone has 7 anatomical structures. We'll really delve into that when you get to restorative art, but I just introduce it to you now. You're not responsible for it on your quiz, but it's good information to know nonetheless. The supraorbital margins are just what they sound like. They're above the orbit of the eye, and they're rims, kind of. They're margins, the area right here that you can feel above the orbit of your eye. The superciliary arches, we've already seen the word cilia to know that cilia means hair. So the superciliary arches, and the arch really gives it away, are your eyebrows. Or it's not your eyebrows, so to speak, but it's the anatomical structure beneath the surface where the eyebrows will rest on the surface. The glabella is the single anatomical structure on the frontal bone, and it's just a slightly raised eminence located between the eyebrows. Frontal eminences, well, you can kind of see mine. Let me see. Yeah. These little areas right here. An eminence is, and I don't believe she has that on there, but an eminence is a raised area. That's all it is. So the frontal eminences are located right here. And then the frontal sinuses are the spaces within the frontal bone. There are 2 parietal bones, which I've already identified to you. They're on the top and the sides of the head, and they articulate with all of the cranial sutures because they're the largest bones. Then we have 1 occipital bone, which spans the posterior floor of the cranium, and it has a very significant anatomical structure within it. It's called foramen magnum. Foramen means hole, magnum means big. So it's a big hole, and it's located at the base of the occipital bone. And I meant to bring my skull home, but that's okay. It's a very large hole, and if you look in your textbook, you can clearly see it in the views of the cranium that they have in the diagrammatic representation. So make sure you take the time to reference your textbook to look at the pictures as well, because the foramen magnum assists us greatly in cases of decapitation. In the event that the head and the torso have been separated, you embalm the head and the torso separately. But you can use the foramen magnum in order to attach the head back to the rest of the torso once the case has been embalmed. You'd actually take some type of dowel or maybe even PVC piping to put through the base of the foramen magnum down into the neck region. Now, one thing I will say about this is that you don't often get cases of decapitation, but in the event that you do, you would still be able to reattach the head to the rest of the torso. And then after you have reattached it and realigned it, you'd suture the muscle back together, and then you would suture the skin on the outside. It will you possibly have to wax and cosmetize, but we use that particular anatomical structure in the event that we have cases of decapitation. The normal usage of the foramen magnum is so that the brainstem can pass from the brain down through the foramen magnum and continue inferiorly to form the spinal column. So it allows for the passage of the brainstem. So 1 frontal bone, 2 parietal bones, 1 occipital bone. We have 2 temporal bones, so that makes 6 bones. Well, the temporal bones have some anatomical structures that we can use to help us to accurately reattach the ear. The temporal bone actually has 5 anatomical structures on it, but there are 4 that we use to accurately reattach the ear. The 4 that we use are the zygomatic processes, which create the widest part of the face. We have the external auditory meatus. Remember, a meatus is a passageway, and if you have an external one, there's an internal one somewhere. The external auditory meatus is actually the whole of your ear, and it indicates where the center of the ear should be. The styloid process is not one of the anatomical structures that we use to accurately reattach an ear, but it is located on the temporal bone. The reason why we don't use that particular anatomical structure is because it's too far anterior to help us accurately be able to reattach it or locate where it should be. It has no influence on surface form. So we don't use that one, but we do use the mastoid process. Once again, a process is a projection. The mastoid process is located right here. And if you feel right behind your ear, right at the base of your lobe, you'll feel a little projection that's right here. That's the mastoid process. And then finally, we have the mandibular fossa. Remember, a fossa is a shallow depression. And that depression is kind of like this, and it allows for the mandibular condyle to rest in it, to allow it to rock back and forth. If you put your finger right here, where you open and close your mouth, you can feel the condyle rock back and forth inside of the fossa. It's right here. Do it a couple of times. Now you know the name of it. So remember, 4 anatomical structures that we use to accurately reattach the ear, but there are 5 anatomical structures that are located on the temporal bone. Then finally, almost finally, we have the sphenoid bone, which I introduced to you a little bit earlier. It's an irregularly shaped bone. Look in the textbook. They say it looks like a butterfly, but to me it kind of looks like a moth. It's kind of perforated. It has some holes in it, but it spans the anterior floor of the cranium. And just anterior to the sphenoid bone, we have a little teeny bone that's really irregularly shaped, and it kind of looks like a loofah because it's got all those holes in it, but it's called the ethmoid bone. Star, stop. No. I'm sorry. Give me that. Excuse me. Give me that. No. Move. Give it here. Move. Move. Sorry about that. She was chewing something up. No. Okay. So we've got the the ethmoid bone. The ethmoid bone has what's called the cribriform plate. Now, the ethmoid bone is situated directly behind the nasal cavity, and what it will allow us to do is gain access to the cranial cavity in the event we have something that's called purge. Thank you, Cole. P-U-R-G-E. Purge is not anything that we want to see, especially if a person has already been dressed and casketed. Purge is the escape of fluid or semi-solid from the intravascular or from inside the body to the outside of the body. And it comes out through an orifice. An orifice is an opening, such as the nose, the mouth, the anus, the vagina. And purge comes in different consistencies. And what that is telling us is that something is going wrong on the inside, and now all of this liquid or semi-solid or whatever it is that's coming out is being forced out by pressure inside the body. So ideally, something is continuing to decompose. So what do? You always treat the cause and not the symptom. Did you hear me? Treat the cause, not the symptom. Treating the symptom is, you see something coming out of the nose. The man is in the casket, dressed and casketed, and you go get a tissue and you just wipe it off and you keep on going. You haven't done anything. It's going to happen again. So you would have to go back and treat the cause. Now, it could be gaseous pressure. It could be that you need to release the gas. It could be fluid buildup that's causing the pressure and forcing that fluid out of an orifice. Whatever it is, you need to make sure that you go back and you treat that cause and not just the symptom. Purge comes in different consistencies to let you know what is actually decomposing. If the purge has a frothy, pinkish white, a frothy pinkish white consistency of purge. And the only reason why it might be pink is if it's tinged with blood. That's indicating lung purge. It gets its frothiness from the oxygen that's present. So that's letting you know, something's going wrong with the lungs. I need to go back in, re-aspirate. And then once I've re-aspirated that cavity, go back and put in some astringent cavity fluid to arrest any further decomposition. That's treating the symptom. But if it's not frothy and it's kind of a coffee, ground, brown, and it smells real bad, malodorous, that's indicating stomach purge. Turn those backwards, I'm sorry. And so what would you need to do? Reintroduce that trocar into the abdominal pelvic cavity and re-aspirate that cavity, then go back and treat it with the cavity fluid, and hopefully that arrests it. But I brought all this up in regard to the ethmoid bone because the ethmoid bone gains us access to that cranial cavity. And the brain can decompose if things go wrong, microbial activity doesn't cease, the brain can begin to decompose as well. And so you would note that that consistency of purge, instead of being a frothy pinkish or whitish pink, it would be more of a creamy consistency. So a creamy, pinkish, whitish, maybe even a little gray. Spell whitish wrong. Yeah, whitish. It could be pinkish, whitish, gray kind of. That's indicating brain purge. Brain decomposing. So, with the other two cavities, well, we should have had too much of a difficult time getting into those cavities because we had our trocar introduction from when we aspirated originally. Well, in this case, we can't introduce a trocar, but what we can do is use a needle and syringe and enter through the nasal cavity, because remember that ethmoid bone is right behind the nasal cavity. And it's perforated. It has that cribriform plate that's perforated. So I could take my needle and syringe and pierce right through that cribriform plate of the ethmoid bone, and I've gained cranial entrance, cranial cavity entrance. Now, what do I do from that point? I would take my needle and syringe and use it to aspirate the fluid off of the cranial cavity, and it would come up in the plunge inside of the syringe component of it. So once it's filled, then I turn, I'd get rid of the fluid that I actually aspirated off, reintroduce it, withdraw more fluid, repeat the procedure until I've gotten as much of the fluid off as I can. And then once I have done that, then I take my cavity fluid and still introduce it into that cranial cavity so that hopefully I arrest any further decomposition from going on. That's good stuff right there. Always treat the cause, not the symptom. Okay, so that takes us to the end of the cranial bones, and that's all that's going to be covered on your quiz. We're not going to move into the facial bones. We will finish those up next week, as well as the rest of the axial skeleton and the appendicular skeleton. You will have access to this video lecture until class time next Wednesday. So it will be up all day on Wednesday up until class at 4 p.m. So come in ready. Don't forget to go to this website to access the diagrams that are at the bottom and practice. I'll choose one of those four. But just in case you don't have the website, it's www.mhhe.com/shear13. And all that is the website for the textbook. When you click on that, you will then go to Student Edition, which is on the left-hand side. You don't need to register for anything. Once you click on Student Edition, a tab should come up that has a drop down. And that drop down tab, you will go to the particular chapter that we're studying now, which is Chapter 7. When you click on Chapter 7, you look down that menu some more and you will see a link that says Interactive Art Quizzes. When you click on Interactive Art Quizzes, it will bring up all of the various diagrams that it has of the cranium or of the skeletal system. Make sure you reference the diagrams that are at the bottom of the last page of the worksheet that I gave you for the study sheet, because at the top of it, it shows you which ones you need to click on. One says skull anterior view, I think the other one says skull anterior view B, and then the other two say skull, another something, skull A and skull B or something like that. But just make sure that when you click on them that they are the same diagrams that are on your study guide. I hope this has helped you. This is a very useful tool. It allows you to have access to me going over the lecture more than that just one time in class. We may utilize it again. So please become comfortable with it. Make sure you have everything it is that you need in order to help you as I am lecturing. You have a PowerPoint presentation, you have any handouts that I may have given your textbook, and of course your notebook. If you have any questions between now and that time, please make sure you just give me an email. I can respond to you as quickly as possible. It's a little bit harder on the weekends just with all the activities and just being the weekend, but typically during the week I can get back to you a little bit more quickly. So I hope you enjoy your weekend, as rainy as it may be, and I will see you on Wednesday. Have a wonderful week.